So thanks so much. I am so happy to be here. As mentioned, I am assistant principal within your North District School Board. And I think that what's really wonderful about this position is it really provides me with an opportunity to see a system perspective. So I'm able to support all of our elementary and all of our secondary schools, but I also have the privilege of working alongside community partners. And the community partner that I'm so grateful for is our health unit. And so what I wanted to do today was provide for you some ideas of some of the types of projects that we've taken on as a team. And really what I want to be able to do is leave you with some blueprints that you might be able to take back to your own health unit or your own school board. I'm a big believer in not reinventing the wheel. And so if there's anything that pops up here today that you would like to try, please reach out to me. I'd be happy to provide you with our blueprint, any of the templates that we've provided so that you can take that and try to enact it or tweak it and then enact it in to suit your context. So the first thing I just want to really highlight is the power of partnerships with our health unit. And so from a school board perspective, and those of you on the line who are from a school board, you can attest to this. We sometimes sit in a very siloed world. And so it can be difficult for us to see and engage with people in different sectors, even though we know the importance and the benefit of doing so. So what I've really found is that our health unit has been able to be that bridge for me. So they've really been very instrumental in helping me to access partners either local to our community or even provincially. And so the first thing I would say, the power comes out of that community awareness. So again, while I have a very good idea of the strengths and needs of children and school-age children particularly, our health unit partners are able to bring a broader community awareness. They're also able to really pinpoint with their own data and their own experts who may also sit at a system level, some of the needs in various communities. So like many school boards, we are very large geographically. We spread over many municipalities, rural and urban sites alike. And so it's been wonderful to have our health unit partners along who are able to identify very specific needs within some of the smaller communities that we serve that might not have been surfaced for us as a school board prior to their involvement or their partnership. They bring a lot of expertise. They're able to provide us with expertise within their own organization that, again, we as school boards just might not have access to. Particularly for us here in the near north, our catchment area is North Bay, Mattawa, Sturgeon, down the Highway 11 corridor, throughout the Almaguin region, South River, Sunridge, so on, and then all the ways south and west to Parry Sound. So they're able to really provide expertise for us to support those unique communities. And another thing I'd say, which is a huge bonus of having a strong relationship with your health unit, is the neutrality that they can bring. We really endeavor to have regular conversations with our co-term boards. But of course, sometimes we have different mandates, different ideas, different priorities. And with the health unit at the table, I find it brings a lot of neutrality. The educational resources that they provide, for example, they're relevant, they're up to date. We know that they reflect best practices. So nobody has to spend time arguing about that. We know that they're bringing that level of expertise and knowledge to the conversation. And so we're able to take that information and run with it. For our health unit partners online, I would say as school boards, why I would encourage you to find the me of the school boards that are in your area and work with them is because we are able to provide you with direct access to those school-age children. And for anybody who's tried to navigate a school board organization, it can be very difficult. It's really hard sometimes to know where to start. You might have a good relationship with a principal or two, but then you're only going to go, your mandate or your initiative is only going to go as far as they're able to carry it out in their own school building. If you're able to get to the board level, somebody, I would say mid-level, somebody like a system principal who is able to disseminate that information and support your initiatives across all schools. So that's really part of the power of the partnership that the school board brings. Absolutely. We also provide an environment for which you can conduct research, which is near and dear to our heart, as we always try to engage in, cycles of inquiry to see how we can improve our practices. We're able to provide information about school-specific data. So, for example, we have, we talk before about the power of having a service agreement or an MOU, that kind of thing. Within our service agreement with our health unit, we have a provision for data sharing. So just like I was saying in the last slide, it's so useful for me to understand the health unit data and what that's telling me about the community that we're serving. So too am I able to provide to the health unit data that informs our steps together. And I'll talk a little bit about that in a minute. And of course, in our breakout session just now, somebody had referred to some of the vaping dollars that have come again through the ministry initiatives. So we sometimes have some internal budgets or some external funding that can come and support some of the projects that the health unit wants to get up off the ground. So really, I think what you can see from these two slides is it's a very reciprocal relationship. There are so many wonderful benefits for both parties. That's why I'm really passionate about supporting people and connecting with those health unit and with the school board partners to forge these relationships, because we really are so much stronger when we work together. So on that note, I wanted to just give you a quick overview of one of the projects that we've tackled together. And many of you will remember this. In 2019, the Ministry of Education had funding to support a working group, resource development, staff training, that kind of thing around cannabis and vaping. They saw it as a need. Many of you probably remember seeing the headlines back then in 2019. We saw school boards taking, washroom stalls off the hinges and things like that. There was a lot of media coverage around vaping in washrooms, and of course that leads to student congregation, which leads to vandalism. So when we initially got those funds, we put together a working group, and right away we tapped our health unit partner to sit in alongside us, on that working group, because we knew that they were going to be able to provide us with that current, relevant, fact-based information coming from a neutral standpoint and helping us figure out how we were going to help kids reduce their use or quit entirely. So we actually engaged in a literature review. We looked at a number of papers and came up with an action research project plan that was going to take a multifaceted approach to combating vaping on campus. Because what we found with that literature review is research would indicate that students who see other students vaping are much more likely to try vaping themselves. And of course, when they try vaping, then the likelihood of them continuing and becoming addicted also increases. So really what we wanted to do was reduce the use of e-cigarettes on campuses. And so we had 5 different recommendations that came through that, and we applied them to one secondary school within our board. One of the recommendations include the installation of vape detectors. So these are devices that look similar to a fire alarm, and they are mounted in any space where you have vaping concerns. So for us, our areas of need were washrooms as well as locker rooms. And again, going back to the data, we were able to use our school climate survey data to identify that students, and in fact, over a quarter of students across our board in all secondary schools, over a quarter of students felt unsafe in the washroom. And so when you think about, what we want to do, and we want to create these safe and welcoming and inclusive spaces, and yet we have a quarter of kids who don't feel safe going to the bathroom, we thought, this is a problem that we need to tackle. And so we installed those vape detectors in the washrooms and some in the change rooms as well, which was the second highest spot where students reported feeling unsafe. And we installed them there. We also included lots of education for students. I went alongside our health unit partner and we presented to the student body. We talked to them about the data. We talked to them about the research that we had done. And we explained why we were using these vape detectors, and that our goal was not to punish them, as many people might think. The goal instead was to be able to have conversations with kids to reduce their use. And really the power of those vape detectors comes from being able to see, wait a second, Johnny, I've talked to you 2, 3, 4 times this week. And what I'm seeing here is that you're unable to get through a 75-minute class without vaping. So for me, that means you need some addictions counseling, you need some support. And so we were able to come at it from a very supportive lens. And again, talk about the reciprocal relationship, our health unit partners had created wonderful resources right on their webpage that helped students with cessation, apps that you can download on your phone for free that helped kids to really understand how much they were vaping, create a plan to quit. One of the things that you see here in the picture that's featured, and there's a video I'll post in the links after there, but this is actually a toolkit that the health unit created alongside myself and some other school board partners to support teachers in educating kids. So when we talk about that multifaceted approach, we had student education. I met with the staff. We developed staff lesson plans and resources that they could embed right into their curriculum so that they would keep bringing forward the facts about vaping and the harm it does to the student systems. We met with parents. We had at our open house in the fall, we had a booth set up and we talked with parents about vaping. And this conversation continued over the course of the whole year. So in conjunction with the vape detectors, these conversations and the education, all supported through our community health partners, we were really able to see a reduction in the vaping on campus and a reduction in the amount of vaping that was happening across the student body. So that's one example of the projects that we've tackled together to really see visible results that we know are going to continue regardless of who's in my position. And that's really what we want, right? We want sustainable projects that are going to continue when we move on to retirement. I just wanted to highlight, oh, sorry, this is the video. And like I said, I'll post that in the chat later. You can take a look. It's a little short video about this resource that you can access online through the health unit. But I just wanted to spend the last couple of minutes that I have with you to share a couple of stories about similar projects that we've tackled alongside our health unit. Because again, if you have, if one of these resonates with you, please feel free to reach out to me and we can provide for you that blueprint of, what we did, how we got started, template letters, surveys, PowerPoints, all that stuff so that you don't have to reinvent the wheel. But one of the things, and this is an example that some of you probably recall going back a few years now, but when we had our PPM around concussion policy, we worked alongside our health unit to develop a coterminous policy. So that way, any of the doctors in our region, regardless of what school board the child was coming from, the doctors were getting the exact same paperwork to complete. And what we found in meeting with them, and that was set up through our health unit partners, is we found that having that consistency across the system really increased the amount of doctors who were able to complete that form and were able to complete that form with the education and knowledge that we needed, the information we needed to welcome that kid safely back to school. So that was a great project. Happy to share resources on that. The next one here is also near and dear to my heart. It's the Immunization of Pupils Act. And so again, many of you have probably gone through this already this year. If not, you'll probably start soon. But it's the idea of those mandatory suspensions related to immunization of kids in schools. And again, we've worked so well with our health unit to really get ahead of this so that we're not in a reactive, or I think from Katie's findings, the word she was using was responsive. Yes, we want to be responsive, but we want to be proactive too. And that comes through strong relationships and great communication. So in this example, what we did, we worked with our health unit to determine when were the letters going to families, what were they going to say, and how could we support our kids in a swift return to school if they hadn't been immunized by the deadline. And I'll give you an example of, the power that comes through these relationships. One of our schools is fairly remote, and many of the kids are bused into that school on a daily basis. They come, some of them are on the bus for 60 minutes or even more. And so, of course, the students who are suspended are not supposed to be riding the bus. But in conversation with our health unit partner, she explained to me that in the past, what the school had done was allowed the kids to ride the bus that day to school, because then the students would walk down the street to the health unit where they had open clinics ready to go. They were ready to be responsive to the need of the kids needing all these vaccinations. So they had these walk-in clinics ready to go. The kids would get inoculated, and then they would email or fax the school. So by the time the student walked back up to school, they were able to enter for the day. And that meant no time lost for this child at all. And so it was just a good example of that. The power of communication, we're able to find solutions and remove barriers for families so that they can access these incredible resources and ensure that we have educated students and parents with these decisions. Safe cycling is a project that we created. We wanted to increase active transportation, especially with our grade 7 and 8 population. And so we wrote a grant proposal with our health unit to purchase a covered trailer and a fleet of bikes. And that now moves across our district for training of grade 7 and 8s. We also participate in a lot of outdoor pedagogical opportunities with our health unit. We know the benefits of kids being outside and how great it is for them. We use the Ophea guidelines for that as well, just to guide that work. And so again, these are just some examples of how we're able to be really responsive to the local needs that we see popping up in our communities when we work with our health unit. And again, some of these needs we wouldn't have known existed if it wasn't for our health unit partner. And then similarly, I can pick up the phone and call our health unit and say, hey, this is the need that's really driving this right now. So for example, the last one, we needed some training for our custodians. There was a low barrier shelter that was built about 2 blocks away from one of our elementary schools. Following that, we saw a lot of increase of sharps on the playground. And together we created an injury prevention education rollout plan for staff, for students, and for parents. So again, a great example of how public health coming together with the school board can really drive the education needs that we see and address them right away. So just in final, as I have said before, I think it's so important to work together and for all of us to develop this network of like-minded people across the province so that we can be sharing these resources.